Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. Every week on this program, I have a different guest, and we talk about different programs, services, or healthcare issues that I think are relevant to you and your family. So I hope you'll stay tuned because I've got a really exciting guest on the program, and we'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Cindy Vawter, who is the Hospice Volunteer Coordinator here at KRMC. Thanks for being on the program, Cindy.
Thanks.
Hospice is, well, it's kind of near and dear to my heart because for the last 10 years I've been working on fundraising for hospice, and I've been a volunteer, and you've been really involved in hospice as well for a very important piece of it, and that's our volunteers. So tell me about that, and what does a hospice volunteer do, and how do you become one?
Okay. Well, I became a volunteer in 2004.
Wow.
I was a volunteer for 4 years before I became employed with KRMC Hospice. So, and then in 2008, I became a part-time receptionist and then moved into the volunteer coordinator position. So having worked out in the field as a volunteer sure was a benefit.
Sure, because you have hands-on and you know both what's needed from the patient side and from the volunteer side.
Right, right. But even in the past 10 years, the training has still pretty much remained the same. Every volunteer goes through a 30-hour training.
Okay.
And we usually hold the trainings twice a year.
Okay.
And
is that like spring and fall usually, or summer and
usually
winter?
we have one that we're just completing now, so we probably won't do another one till fall.
Okay.
But they can come in if they're interested, stop by the hospice home at 812 Airway and pick up the information. I have a packet, and they can fill out the application.
Great.
And then they bring it back to me, and then when I schedule a training, I'll give them a call.
Good. Well, and I think that's good for people to realize is that you have that in-depth training, so you're not just like kind of throwing them to the wolves, if you would, or expecting them to just know everything, because obviously they don't. And it's scary, maybe for some people.
And even for volunteers who've been a volunteer for a while, each new patient they go out to visit, each home they visit, you still get that heart beating a little bit faster when you're the first knock on the door. But it's very rewarding. And during the training, they do hear from our staff, from our chaplain, our social workers, our bereavement counselor, our nurses. So they hear from all the different aspects of our services.
Well, and again, I think that's important for people to know is that they have that support as well. I mean, there's the whole hospice team that's there for the patient and family, but they're also there to help the volunteers too.
Right.
You give a part of yourself when you're a volunteer as well.
Right. We treat our volunteers just like employees. They have to go through all the health requirements that as employees have to go through too. So they are treated like an employee, although they don't get the paycheck, as I tell them, but they're very important to our team. And as a hospice, we have to have 5% of our staff hours has to be volunteer hours.
I didn't even realize that.
That is a requirement, Medicare requirement. So when we're audited, they do check the records. So when our volunteers do go out in the field and volunteer, or even in the hospice home or community service, anything they do, we keep track of their hours.
Okay.
And every month I have to do a report. So then when we do have auditors or surveyors come in, that I have to show them on paper what our numbers are, and that 5% of our hours are volunteer hours, or we can get written up for that.
And there's a lot of different ways that people can volunteer, right? It's not just, I mean, I know I've heard some people say they really want to help, but they just don't know that they can do that in the home personal care. But what other aspects are there for volunteering?
They, now that we have the hospice home, there's many ways they can come in and help on the front desk, answer the phone, do paperwork, computer work,
welcoming visitor patients and
somewhat. I compare it to maybe here, like at the hospital, the volunteers at the front lobby.
Desk.
We always have volunteers here at the front at the hospital, and that's kind of at the hospice home. We have a desk at the front, and so we always like to have someone up front there.
Great.
And then we do have a kitchen there at the hospice home, so we are known for our cookies.
Yes, every time you go there, it's like
Yes,
What's baking today?
We have cookies out every day, so we have volunteers that bake cookies. So
That's a
if they
tough
like
job.
the kitchen, they can bake. And any staff member or volunteer that go into the kitchen at the hospice home has gone through the county food handling.
Food handling,
class.
okay, that's good for people to know as well.
So they do have to do that. So they can go in the kitchen, they can help with the yard work, they can help with scrapbooking. We have a scrapbook
I have
on
a couple
all
of
of our
different
people.
projects like that. Are you still doing that bear, fabric bear?
We just switched to a memory pillow.
Oh, fun.
From a bear to a pillow. That way
Okay.
we can salvage more of the article of clothing. They bring in a shirt and then we cut it like a square,
pattern
make
from
a
it,
square
okay.
pillow. So
Very
our
nice.
volunteers do that.
Okay.
I like to find out what the volunteer likes to do.
What their personal interests are.
and then put them to work that way.
Sure, that makes
So-
it a good fit. But now, if the volunteer wants to do more of the patient, relations, what kind of things are they doing with the hospice patient?
They are there as a companion. They are limited to what they can do.
Okay.
They can't do more than they can do, so that's why we say they're a companion. They cannot give medication, they cannot transfer the patient like from the bed to the chair.
Okay.
They can assist them in
If they're able
moving
to
them,
get
but
up
they
and-
cannot actually, the patient has to be able to use his or her weight to do it too.
Okay, sure, that makes
and the
sense.
medication, they can remind them to take the medication, but they cannot actually put the medication in their mouth.
Okay.
They're there as a companion
And a friend.
to visit and listen. They're there as a listener.
And they kind of give breaks for the family members too, right? 'Cause
Right, right.
Let's go over a little bit about hospice. I mean, to be eligible for hospice, a person has to have a diagnosis from their primary care that they're in their end stages of life, right?
Right.
And what is the prognosis? Is it 6 months or less?
Generally, they say 6 months or less, although no
Yeah.
one really can tell when someone's going to die. But the doctor usually says if the illness proceeds as the normal illness, that it would be 6 months or less.
Okay.
But that doesn't mean if after 6 months we're going to
Kick them out.
kick them out. Kick them out.
You've been here too long, you go
They
now.
are certified at the beginning, 90 days, then every 60 days.
Okay.
And if the nurse can show a gradual decline, somewhat of a decline, then they remain on hospice. So they can be on hospice a year, 2 years. We had someone on for 4 years. Now,
Wow.
that's not typical.
Right.
But if they're showing a decline every certification period, they still will remain to qualify for hospice.
Okay. And to be qualified for hospice, another part of that, though, is that you have to have a caregiver, right? Someone
Correct,
that's going to be
yes.
able to be with you basically
Yes.
24/7, right?
Yes, when that time comes. Now, when they come onto hospice, they may be at home living alone, but when the time comes when they can no longer live alone or they need assistance around the clock, they need to have someone designated as a caregiver,
Okay.
whether that be a family member or a neighbor, a friend, or an assisted living home that they're going
Okay.
to go live at. They have to have a plan B
A
in
plan-
place.
Right, right. And then that volunteer then, I guess what I was leading to with that is that the volunteer then can be a little respite almost for the caregiver, so come in and stay with the patient if the family member or neighbor needs to just get out for a few hours. I know
Right.
I did that a few times when I was volunteering, and I would go and sit with the patient and we would just chat or read a book or help write letters, whatever, while their caregiver went out for a
Right,
while.
and sometimes they're sleeping.
Right,
When
right.
you get there, and they're sleeping when you leave.
Yeah.
But yeah, what we usually do is assign a volunteer to the patient to visit once a week, the same day of the week, the same time.
Okay.
That way, then the caregiver knows
plan.
what day that volunteer's coming, and then they can plan if they need to schedule appointments or
Sure. Have their own personal time.
Go to lunch.
Right, yeah, just get away
Go
for a
lay
little
down.
bit. Yeah, take a nap themselves.
Yeah.
Well, and then again, I guess I wanted to talk about the whole hospice team because there's so many aspects of that teamwork. You talked a little bit about, we've got the social worker and the nurse,
Right.
and the chaplain and the bereavement counselor, right? Is that
We have the
and
CNA,
volunteer?
the certified nursing assistant, who can help with bathing, showering, washing hair,
Okay,
changing bedding, those
those
kinds
kind
of things.
So there's a whole team that kind of tag team, if you would, right? As
Right.
far as caring and reporting on the patient and letting them know what their needs are and what needs to happen next.
Right, and then we have weekly meetings,
Okay.
and so that way then the team members can
Get
voice
together
any
and talk.
concerns, or if there are any, and
Share
everybody
notes
knows.
on the patients and what they're doing. And then with the hospice home, now I think that we need a little clarification for that as well, because sometimes people have had the misunderstanding that they could just go and stay at the hospice home until they passed. And that's not quite the case.
No,
Let's
it's not.
clarify that.
We call it a revolving door, short term, in
Okay.
and out. Yeah, people can come in for respite for up to 5 days at one time
Okay.
during their certification period, or they come in for what we call symptom management. If they've got something going on, they have some pain, they can't get under control, vomiting, diarrhea, something where the nurse feels that they need a nurse 24 hours a day, then they can come into the hospice home. And that can be overnight, or that can be a week or 2 weeks. It just depends on the individual.
Okay.
But normally then they go ahead and go back home once we get that under control, and,
Okay.
they go back home. Because
Okay.
that's what hospice is. You want to
Right.
remain at home on your final days.
Well, and,
so.
and that, yes, that's the, I guess maybe that's one of the things we should have clarified at the beginning, that is truly the benefit or the gift of hospice, is that it allows a person to be with their family in their own their home environment, with their family and friends and pets and everybody else
Right.
around them, their
Right.
comfort zone,
Right.
versus being in a hospital, and it's a big difference, especially towards the end when you want to have that more of a comfort level. So, so it's good to know that we have that
Yeah.
program for them.
And we are very fortunate to have the hospice home here
Oh,
in
it's-
Kingman for our people to come to, and it's a beautiful facility, and we love to show it off.
Yeah.
So we always encourage people to come in so we can give them a tour.
Sure,
And we
and-
always have cookies.
And they don't have to be dying to get in there to see it, right?
Right, anybody can come in and,
Okay.
and have a tour. Even groups have come in and had meetings there. We love to show it off because
Right.
it's a beautiful facility.
It is, and it's got the beautiful garden in the back and lots of different, and that beautiful piano. Now I heard we have a volunteer who comes once in a while and plays that piano as well.
We have we have 3 different volunteers that come on a regular basis.
Wonderful.
One is a gentleman that's a nurse at the hospital. He comes.
And he's amazing. He played
He
at the
is.
birthday party the first time I got to hear him, and I was just awed.
Yeah. So he's one of 3 that come, but they do
Great.
come on a regular basis and
Play the piano.
play
That's
the
nice.
piano.
Yep. We've been very blessed in our community that we had so many generous donors that stepped up, and different parts of it, the Becker family obviously, and the Lingenfelter family, but then many others as well,
Right.
who have given different parts to different financial things to help us continue to build and add to it and make it what it is today. So it's pretty cool.
Yeah, it is.
So before I forget, we want to give your phone number. So if people have questions about being a volunteer or want to learn more about it and how they can do it, so what is the number they're going to call?
It's 928-681-8710.
Okay, 681-8710, and that goes pretty much to you.
To the hospice
To the
home,
hospice
directly
home.
to the hospice home.
Okay, very good. So we'll, they can call you to learn more about it, and that'll be awesome. And then we're going to take a quick break, and I want to talk about another part of things that you're involved with.
Okay.
You're a busy lady. Anyway, I hope you'll stay tuned because we have more to talk about after these breaks. Welcome back to Your Health Matters. My guest today is Cindy Vawter, the Hospice Volunteer Coordinator for KRMC. Thanks again for being on the show, Cindy. We had talked before the break about being a volunteer and what all that entails. And we talked during the break about what it is you do for the volunteers to kind of help prepare them, because death is scary for everyone.
It is.
But
It
it's
is.
got going to happen to us also.
Yeah, and during the 30-hour training, we do one session. We have Rhoda, our bereavement counselor, comes and talks to them, and then is always available for them after, if or when they need them later on. And Denny, our chaplain, comes and talks at a session. And then our social workers, one of them comes, and one of the sessions is about caring for you, meaning you, the volunteer, caring for yourself. Ways to take care of yourself, and setting boundaries with volunteering.
Don't
and
give too far or too much.
And then occasionally too, our volunteers do take a month or two off, and when they, if or when it gets to the point where they just say, oh, I can't do this anymore, I want to resign, what I like to do is say, just take 6 months off, and then don't
see where you're at.
And then let's talk again and see where you're at. And if you still feel the same after that, then I'll accept your resignation. If not, then come back. And usually, after a couple months, they're ready to come back. They just need some time. And
sure. Well, and you do get kind of emotionally attached to your patient.
Yeah, and they know. And I tell them to let me know how they're feeling too. That when one of their patients does pass away, that they, I like to give them a month or so, if longer, depending on the volunteer, before I assign another patient to them. And they let me know. Sometimes they say, I'm ready for another one now, and sometimes they say, I'll wait a while.
Some have been doing this for a long time.
Because how you react to one may not be how you react to each patient is different. Yeah.
Right.
Yeah, we have a volunteer that's been a volunteer for since the beginning, 2001, and has had many patients, and she says everyone is different. So until they actually experience, I don't think they even really know how they're going to be feeling. But we help them. We're there for them.
Well, and I think that's the important thing, and that we talked about earlier in the show too, that you have tools there to help them, and they're not alone in that whole process.
And we do have monthly volunteer meetings. They are required to come to 4 meetings per year, and 2 hours of continuing education and palliative care. So at our monthly meetings too, then, is the time to...
It's kind of like a support group, right, for them.
It is. Yeah, it is.
Yeah,
it is. So.
And are there any areas, I mean, I know that we can go all the way out to Meadview. We've had patients in Meadview.
We do, and we now have volunteers in Meadview
That's
too,
a good
which
thing.
is exciting. Yes,
very good.
We do. We go a 60-mile radius. We cover a 60-mile radius. Meadview, Peach Springs, then down, I guess, south would be Wickiup area, or north of Wickiup. We do not go to Bullhead City, even though that's within 60 miles. But
they have their own hospice.
They have their own there.
And Havasu does as well.
And Havasu does too. Yeah, Yucca is kind of the
so we do kind of go to Yucca if there's patients.
Yeah, and when someone calls from Yucca, what we like to find out is where's their doctor, Havasu or Kingman.
Sure, that makes sense.
And then that would be the hospice that's covering them.
That makes sense, because their doctor is their referring physician, and they usually stay pretty closely attached with the patient care as well.
We do go Dolan Springs and White Hills.
Okay. So that's a big area to cover, and I'm sure you always could use more volunteers.
We sure can.
Well, that's good to know. Well, Cindy, now I wanted to also chat with you about some other things you're involved with, because you and your husband, Don, are very caring, involved in our community individuals, and you've been very active in a program called Live Now.
We have.
And let's talk about that and what that does, because I don't know if all of our viewers have heard about Live Now and what you guys have done in the past.
Live Now started in 2010 by Dr. Lunn from KRMC and nurse Leslie Martin, and they have been traveling to Africa to do medical education missions. And my husband Don first went to Africa in 2006 and fell in love with the country and met a gentleman named Modest Bio over there, who was a safari guide. And was starting a school at that time too. And over the years, he stayed in contact with Bio, as we call him. And so when the Live Now group was looking for a contact person over in Africa, having trouble trying to make connections, they knew Don had been over there and had this connection with Bio. Put Live Now put Dr. Lunn in contact with Bio.
Awesome.
And so Bio then has made arrangements for Live Now to their medical
So
mission.
when Live Now goes, they do it once or twice a year, right?
They have been going once a year,
Okay.
although they did not go last year.
Okay.
The year before, Donna and I went along, and that was quite an experience because Dr. Tedesco also went.
Oh, that's
and
right. Yep. And Billy.
Yeah, and did hysterectomies to
Oh my goodness.
ladies that
Wow.
were in need of it. Yeah, with
Wow.
medical
And that's
conditions.
yeah, I was going to say, and that's in not quite the healthcare arena that we're used to here.
Yeah, yeah. So
Because that's part of what they've done, right? Didn't they help build a clinic down there or put a facility together?
right, there is one that they
Okay.
were helping with, yeah,
Okay.
and Dr. Lunn is looking at another facility too, or
Right.
hoping
And I'm
to
sure the
build
need
a
is-
facility
The
of
need
his
is
own,
huge.
actually, yeah.
Oh, okay.
And but this last trip we went, then we met Bio's wife, Lightness, who has started a girls' vocational school
Oh, wonderful.
out in her little village where she grew up.
Oh.
And this is for young women, young mothers who have had babies or are having babies
Okay.
who can no longer go back to school because
Oh.
once they have a child, they can no longer go to school.
Oh, okay.
So Lightness has started this girls' vocational school for these young ladies so that they have a
Can finish their
vocation, that they have some way to earn some money
Okay, to support
to
themselves
support
and their
themselves
baby.
and their
Okay.
babies. So Donna and I fell in love with that school and are now in the process of starting a nonprofit group to help her and her girls
Wow.
get sponsorships for that, and also work in conjunction with Live Now, with them doing the medical side
Okay.
and then us on the educational side, and
Uh-huh.
hopefully to be in the same area over there
So you can work together and,
and
kind
work
of combine.
together.
Awesome.
Yes, and
That's
work
great.
together. So
Well, if someone wants to learn more about those programs or be involved, and I know there's many areas they can help, whether they can actually go to Africa, but maybe they can help with fundraising, because I know you have a number of different projects you've done. So how do they get in touch with you guys?
well, Live Now does have a website.
Okay.
If they go online and search for Live Now,
Okay.
Kingman, it will bring that up, and that would be on the medical side. On the school side for the girls' vocational school, we will be having a website, although we don't have that yet. We're
Okay.
still in the process of getting the name and that, but they could contact me at the hospice home.
Okay, good.
Um,
We'll
if they
give
would
that number
like
out
it.
again. It
Uh-huh.
was
681-8710.
okay. 68. I'll know that by the end of the show. 681-8710. So they could call you and you can.
and we could get more information
Okay.
to them.
So what kind of things do you need for that? Do you know yet? I mean, I know this is brand new, so maybe you're not even sure what all you're going to need yet. But.
Well, and the way we're hoping to help is have a website, and then people can go onto that website and sponsor a child or sponsor a mother, sponsor a teacher. Like, for instance, a teacher for her school that teaches sewing, knitting. She also teaches health classes to the children too, or
Okay.
young ladies. I shouldn't say children. Some
Right.
are like children,
Young mothers,
but young
yeah.
mothers, because some of them don't even, sad to say, but don't even know how they became pregnant. So how to teach them how not to become pregnant
again, and probably to care for their babies
and care
that
for
they
'em,
have.
yeah. So she does pay her teachers. She has 2 teachers right now, and she pays them $150 a month.
Wow.
Is all. Yeah. So we're hoping
To give them a raise.
yeah. And
Wow.
her website is actually Lake Eossi Girls Vocational School.
Okay.
And so you can get more information on there.
Okay, but I think most important, we'll
So-
give them your phone number again. That's 681-8710.
Right.
See, I told you I'd get it by the end of the show. So they can call you and you
Yes.
can steer them in the right direction.
Yes.
Thank you, Cindy, so much for all that you do in our community
Thank
and
you.
for being on the show and talking about that today. I hope you learned something today. I know I did, and that you'll join us again next week, and I'll have another exciting guest on the program.